Our goal is to bring you pertinent and engaging information about the health of you and your loved ones, so let's get started. Hi everyone, this is Megan from My Spine and Joint, and I'm here with Dr. McPherson today. So, My Spine and Joint is located in the Skyway Marina District, so what sets that apart from other locations local to the St. Petersburg area?
Yes, My Spine and Joint's at 4831 34th Street South. We are conveniently located off of the Bayway from the beach side, 34th Street South, even South St. Petersburg, 54th Avenue South, and right over the Skyway coming out of Bradenton in Parish. So very conveniently located. The next closest chiropractic office and rehab office is all the way on Central Avenue, which is still about 10-15 minutes away. So this office is very convenient for a lot of people.
Definitely, it's a great location too. And do you have any options to make this affordable for every individual, or what kind of things do you offer to make it affordable for them?
Yeah, so we accept a lot of insurance plans, which a lot of offices don't do that, but we've decided to accept most of the major plans in this area. So Cigna, United Healthcare, Florida Blue Cross, and some other plans as well. Sometimes we can get it out of network with some of your other plans if you're not in network with us. But more recently, we've added on Medicaid, which is very good for this area and this demographic. We have a lot of patients who were unable to reach us before, but they can now see us because we accept those plans. So we do take Simply Healthcare, WellCare, Stay Well, some of those plans as well, and Medicare, of course. And if a patient doesn't have an insurance plan, they can pay out of pocket. We do have a very competitive prices for our adjustments, so our first visit is much less than you would pay anywhere else, and a lot of times your copay is just about what we charge for our office visit anyway. So sometimes people have that, they want to use their insurance if they have it, which I understand, but our cash price is so close to their copay anyway that we can make it comfortable for them.
Yeah, that's great options for everyone.
If you're looking for the latest technologies and protocols to maximize or regain your health, My Spine and Joint is the solution you need. Offering effective pain relief, skin rejuvenation, painless laser body sculpting, fat loss, sports performance, and so much more to help you look, feel, and play your best. They're now accepting new patients with or without insurance. You can ask for them or call them directly. Their state-of-the-art solutions can get you on the road to better health today.
So a lot of people suffer from headaches pretty regularly and in some cases even daily. Is there any way that My Spine and Joint and chiropractic care in general can help these individuals?
Unfortunately, people do suffer with that quite often. And migraines, some people take over-the-counter medications or even prescription medications. Chiropractic can be very helpful in those situations because the majority of the headaches a lot of times come from tension or stress or nerve irritation within the neck. So as we line that up and we make those adjustments, we take pressure off of the nerves. That does allow for a lot of relief for the patient. So some patients, their symptoms aren't necessarily indicative of a neck issue, though it may be something else causing the headache. So if it's not a true spine or neck or nerve issue, then it may not be as successful. However, chiropractic can help to decrease the amount of medications the patient may need to take, or may make the symptoms less severe, so it makes it more manageable. But as you adjust the spine, what we're trying to do is really just take pressure off the nerve, and that's usually where the headaches are coming from, that are leading upward to the back of the head and the side of the head. And also allowing for better flow of the cerebrospinal fluid, which kind of bathes that brain and that brain stem and that spinal cord. So between addressing those two things with an adjustment, a lot of people have good results with chiropractic care.
Okay. So a lot of people suffer from bulging or herniated discs. Is there any role that chiropractors can play to help these individuals?
Yeah, so bulging and herniated discs, a lot of people suffer from that. You know, it could be something as simple as lifting a bag or lifting your child, or it could be something more severe like, lifting and twisting with your jaw, or lifting a 50-pound bag of sand or something like that. So discs can be very finicky, and that doesn't take much to get them aggravated, but when they're aggravated, it can become a chronic condition, unfortunately. We do have a lot of services here that a lot of other practices don't have. We have obviously the adjustments, which is, in my opinion, one of the best things you could do. It kind of just gets everything back in place, and it takes a lot of physical pressure off of the joints and the disc and the nerves, which are really the three things that give the most pain in that situation. But we also have a spinal decompression table, which is very amazing at how it works, in that you're on your back. It's kind of a zero gravity position, and it really helps to distract and open up that disc space, and it helps that disc to heal. So the discs don't have much blood supply, if any, in most areas. How it gets its healing nutrition is through imbibement or fluid or motion of fluids into the disc, through nutrients and such. So the table does a good job of kind of pushing that in and out of the spine to kind of help that healing process. So with one visit, a lot of people do have some results, but it does take a little more time, sometimes more of a therapeutic approach to kind of really help reposition and set that disc where it should be. The other service that we have is flexion and distraction. So in a different way to address the same issue, depending on how your disc is bulging, whether it's left or right, or even just straight to the back, we can position you on this table to kind of help specifically target a disc area between flexing it and distracting it at the same time to accomplish the same thing, opening up the spine to allow the nutrients to kind of head back in the blood flow and things like that to head back into the right areas to help with the healing process. So those two things are kind of unique to this practice. There aren't too many clinics in the area that offer that, but in conjunction with the adjustment, they can be very effective in managing disc bulges and herniations.
Okay, it seems like a good option for patients who don't want to immediately seek surgery as a first option as well.
Very good point. Yeah, it's definitely our goal always to avoid surgery if we can. Sometimes it is warranted, but in most cases it's not. And your outcomes long term from surgery sometimes aren't great either. So it's good to kind of put that in place before your surgical intervention, because that may resolve your symptoms and keep you from actually needing the surgery. So we do get a lot of referrals for that too. Sometimes somebody might be pre-surgical and the doctor may refer to us and say, hey, we want to try this decompression service or whatever you have to offer. And many times you will find that you may not need the surgery after that. So that's a very good point.
Yeah, absolutely.
Get to know the trusted leader for chiropractic, sports injury, and auto injury care in Pinellas County. Dr. Michael McPherson of My Spine & Joint is the choice of your community. With state-of-the-art equipment, great access from many main roadways, and a warm, welcoming environment, it's easy to see why many choose My Spine & Joint for their injury and health needs. Known for thorough and compassionate care, Dr. McPherson takes pride in helping patients of all ages realize their health goals.
So a lot of people tend to go to a massage therapist for back pains and different uncomfortable situations. Is there any role that a chiropractic care plays with a massage therapist in a synergy type ordeal that would help the client even more?
Yeah, and biomechanically or musculoskeletal, let's say, if you look at how things are working within the body, like your shoulder joint or even your back or your neck, I guess more importantly or applicable here, if we work on the joints and the joint function and then the muscles are attached to those joints, it makes sense to work on both at the same time, whether it's delivering the adjustment or the treatment or whether it's post-adjustment and treatment. Having a nice musculoskeletal system or a muscle and tissue, fascia, all that stuff moving nicely, nice and relaxed is only going to help the adjustment have a better impact on the body. So we like to tell our patients it's up to them if they want to get massaged prior to the adjustment or after. I don't believe I've seen any research to say one way or another, but I think it does go hand in hand. If I make alignment in your upper neck, your muscles have memory too, so your muscles still think that joint is in a bad position and it's going to keep pulling on that and it's going to pull you back out of alignment again. So sometimes we see that with patients when we make an adjustment, they're not sure how many times they need to come in or what's the next step, but sometimes it's that muscle pattern that needs to be fixed or disrupted, and then the adjustments will start to hold longer and you'll get better relief. So we do have massage here in-house, which is great now, by appointment, but we also refer out all the time for massage, or if you have a massage therapist that you like, that knows your body, then we will definitely work with them to make sure you get where you need to be on a functional side.
I see. It's very interesting. So does My Spine & Joint have any type of treatment plan in place that differs from other practices in the area?
Yes. So our practice, what we try to do is obviously get you out of pain day one, but we find that sometimes that it's not the case. You may need a few extra visits to at least stabilize the condition. So we'll always follow up with you the day after just to see how you're doing, but we usually try to schedule you for another visit just to follow up and make sure things are holding where they should be. In the event where you need a longer treatment plan or a plan of care, we do set those up based on your need. So we'll address it specific to your diagnosis, some of our exam findings, and any other kind of objective measures such as an MRI or something like that that we need to address. We try not to do any long treatment plans like some other offices may do these big packages. We never sell packages for chiropractic treatment. It's really just based on how you're progressing, and as soon as you're feeling better, we try to get you to a point of maintenance, and that's important for me. I try to really make sure that we're changing making an impact on your lifestyle in a way that you're healthy and stable enough, and you know how to take care of yourself with certain things at home. And we may see you once every 4 to 6 weeks at that point. So we try not to do anything long term to recap, but in some cases it may take more than 1 or 2 visits to get that stabilized.
Okay. So does My Spine and Joint offer any financing plans to make your additional services in-house affordable?
We do. We try to make our initial prices as comfortable for people and economical as we can, but unfortunately that's not always the case. So we brought on some other services that I think will be very impactful for people. They allow them to get the services they need, but not have the barrier of the finance at the time. So we do have some patient financing options in-house, similar to other practices that many people may have experienced at a dental office or something like that. So it allows them to get the care that they need without worrying about the finances up front. So we can break that up over a period of months to make it comfortable for the patient and still provide the service that day. So looking at some of our other services that we're looking to offer, it's going to allow them to take advantage of more that we have to offer them to get better.
Okay. So for anyone interested in seeking care at My Spine and Joint, do they need to have a referral to come into the office?
In most cases, you actually don't, and that's a lot of times the question we get from patients when we're out in the community doing things is, I need to speak with my primary care, or I'll get a referral to come see you, and you'll find that many times you don't need a referral, which is great. So here in Florida, chiropractors are considered a primary care specialist, which is great. So you can come to us as a portal of entry for anything you're experiencing, really. But some plans do require you to have a referral. So some of your Humana plans or some of your out-of-network plans will require that. But we'll always let you know that at the front desk, and it's pretty easy to get. Most doctors are willing to provide that referral, but in most cases you actually don't. You can call us directly, whether it's a car accident or whether it's just back pain, neck pain that you're trying to have addressed. You can come and see us directly. You don't need a referral. We'd like to work with your provider, your primary care provider, so either before coming in or after we've treated you, we'd like to reach out to them to at least have that communication so we're both on the same page, again, working for the best, in the best interest of the patient. So simple answer is no, you don't always need one, but in very rare cases you may need one.
Okay. That's all for our show today, and remember, always seek emergency medical care first if needed. But if you feel one of your loved ones or yourself may benefit from our services, please feel free to call or text us at 727-475-2608. We'll see you next time.